Good afternoon. You may be seated. Good afternoon and welcome to the School of Public Health Fall 2019 Convocation. Today we're here to recognize and celebrate the accomplishment of 28 graduates, all of whom have completed a rigorous and challenging course of study. In doing so, they've successfully navigated many exams, presentations, research papers, and the dreaded group project. Nothing teaches life skills like the dreaded group project. Graduates, your academic program has trained you and prepared you to make an impact, to make a difference that improves the public's health. While we work to serve the entire population, you've learned that we place emphasis on serving those populations that experience inequities and disparities in health and well-being. As you begin your career, you'll be faced with choices regarding which problems to tackle, which communities to serve, and how hard to push for change. In public health, we believe that a person's health and well-being should not be determined by their race or ethnicity, their identity in terms of their gender or sexual orientation, or how much money they make. It should not be the case that where you live dictates the cleanliness of your water or air, whether or not you have access to safe and healthful foods, and whether you or your family can access health care, safe and affordable housing, or effective transportation systems, or high-quality education. These basic needs should be available to everyone. In your work, graduates, remember that you are champions for those who have been placed on the margins of society, those who lack economic and political power, and those that have been told implicitly and explicitly that they're less valuable. In public health, we fight against injustice, and a wise and courageous man once said, "We're not simply to bandage the wounds of victims beneath the wheels of injustice, we're to drive a spoke into the wheel itself." You will have to fight for those who are vulnerable again and again and again. Whether it's fighting for public policies and programs that promote health, like maternal and child health, or access to health care and preventive medicine, or whether it's fighting against corporate practices that threaten health, like those associated with tobacco, alcohol, unhealthy foods, and environmental degradation. These are fights worth fighting. We, the faculty, have engaged you, trained you, and watched you develop and grow. The faculty have certified you, approved you, and stamped you ready for the work ahead. Go forward with purpose, with confidence, and with commitment to the work of social justice. It is the work of public health. You're ready to make a difference. Go forward and do it. We're here today to celebrate you and your achievement. So before we proceed with the program, I invite all of you that are attending here today to join me in applauding our 2019 graduates. At this time, I'd like to invite Denise Gavea, Director of the Office of Academic Assistance and Career Services, to introduce our student speaker.
Thank you, Dr. Lynn. Good afternoon. Today and this afternoon, I have the pleasure of introducing our student speaker. Janvi Dubashi is graduating with her master's in public health degree with a concentration in health management and policy. She also graduated last year from Georgia State University with her bachelor's degree in biological sciences. Her graduate thesis is entitled "The Relationship Between Parental Criminal History and Substance Use on Child Mental Health." Throughout her program, Janvi has focused on service, advocacy, and student engagement. She founded the Georgia State University chapter of Health Students Taking Action Together, also called HSTAT, and serves as the organization's president to work across the Atlanta area to empower graduate students to serve their communities through the lens of health equity. Since being accepted into her master's program, Janvi has held several positions, including at the National Institutes of Health, at the Centers for Disease Control and Prevention through the Division of Heart Disease and Stroke Prevention, at Myers and Stauffer as a behavioral healthcare consultant, at Voices for Georgia's Children as a policy and advocacy intern. At Georgia State University, she has been a molecular biology supplemental instructor, a graduate research assistant for Dean Lin, with whom she recently published an article in Current Obesity Report entitled Global Implementation of Obesity Prevention Policies, a Review of Progress, Politics, and the Path Forward. Janvi is also a Community Health Leadership Fellow for the Satcher Health Leadership Institute and was awarded the J. Rhodes Haverty Scholarship for the 2018-2019 year. She plans to continue to work in the fields of policy and advocacy through the lens of medicine. She will be applying to medical school after graduation with the goal of becoming a primary care physician. Please join me in welcoming Janvi Dubashi.
Hi, everyone. It's always really weird to have your resume being read out loud, but thank you, Denise, for the introduction, and thank you all for coming out and for supporting your graduates. I actually hadn't told my parents that I was speaking up here today, and I can assure you that their faces right now are just pure surprise. So, my name is Janvi, and I am so honored to be standing up here today. And I am so proud of my graduating class. You all are my friends, and I'm excited to have you as my future colleagues. I truly believe in the importance of showing gratitude to all of those that have allowed us to be where we are. And with that, I want to say thank you to my parents. They immigrated to this country 30-ish years ago with the hopes and dreams of higher education, and they've always allowed me to follow my dreams. Thank you to my friends. You all serve as my support system, and you've given me the strength to stand up here today. Of course, thank you to my graduating class. You have created this space of learning and of innovation and of questioning within our School of Public Health, which I think serves as an inspiration to us all. And of course, thank you to Dean Lin. He has been my mentor for the past year, and I think that he has served as this catalyst to a series of just positive experiences that I've had in grad school. And I think that his mentorship serves as a testament to all of the incredible professors and mentors that we have here today, and their commitment to their students. If I were to ask every graduate who their favorite professor or mentor has been and why, I think you'd all tell me a different answer. And this is the beauty of our school. You can trust me on this because I'm about to be a double Panther. As Denise said, I graduated last year with biology, and I'm graduating today with health policy, so I know what I'm talking about when I say that our professors have embraced the responsibility of empowering generations of thinkers into recognizing our blind spots, both moral and intellectual. They have allowed us to critically think through solutions and to thoughtfully challenge the status quo. And as graduates, it is our responsibility to ensure that all those around us are able to learn from the experiences that we've had at Georgia State. So now I want to use the platform that I've been given today to talk a little bit about privilege, because I know that some of us are tired about hearing of these privileges that we didn't even ask for, and others of us don't even think that we have any to begin with. But all of us are part of a very small minority. Less than 7% of all people on earth have a degree after 12th grade. And as we sit here about to receive our master's degrees, the numbers become even smaller. We have access to academia and literature and pedagogies which are unattainable and inaccessible to a majority of the world. We need to recognize this and acknowledge the biases that we hold so that we can use this privilege to dismantle harmful social, political constructs and institutions. These institutions, such as the patriarchy and racial capitalism, along with failed policies such as the war on drugs that have led to mass incarceration, are all examples and drivers of health disparities. I think Angela Davis said it best. In this society, dominated as it is by the profit-seeking ventures of monopoly corporations, health has been callously transformed into a commodity that those with means are able to afford, but that is often too far beyond the reach of others. We will be sitting at many important tables in our career, and sooner than we think, we're going to be heads of those tables, leading those important discussions. But I always want you to think about who is not at your table and whose voice is not being heard, because it is our responsibility to dismantle the systems of oppression which have led to their exclusion. I know sometimes that we all like to think that public health is apolitical, that we are inherently good because we're focused on population-level health. However, our career to a large extent, and our field to a large extent, are focused on controlling the health decisions of large populations and of allocating their health resources. There's a certain power that this field holds, and it's necessary for us to begin to address the fundamental causes, otherwise known as the structural and social determinants of health, as many of them are driven by money, power, and resources. We would be remiss to draw a line between social justice and public health, and I would go as far as to push back and say that that line shouldn't even exist. We know that change only happens with collaborative and cooperative action. And while we're all young now, I want us to start thinking about the legacy that we are going to leave behind as this generation of public health leaders. So now, I want to ask you all a question, and that is, what brought you to the field of public health? I know most of us have had really circuitous paths. I don't think any of us were 5 years old dreaming of being a public health professional. And I doubt we're in this for the money. So really, think about what brought you here. And if any of your answers include wanting to improve the healthcare system, or wanting to ensure that all people have access to their highest attainable mental and physical well-being, then I want you to hold on to those answers. Hold on to that and always let that be your motivation to all the high and mighty places that you're going to go in your career. Do not become part of the systems that create and propagate health disparities, and do not accept the boundaries that society's current structures have put in place, even though it is easy and it is comfortable to do so. So I know all of us graduates in the room have seen that picture describing equity versus equality. But for those in the audience that might not know what I'm talking about, I would like to paint you that picture. I want you all to think about a baseball field with a tall surrounding fence, and on the other side of the fence are people that wish to look in and see the game. Under the premise of equality, we're giving everyone an equal-sized stool to stand on so that they can hopefully look over. But we know that people come in all shapes and sizes and heights. So while this will work for some, it will not work for all. Under the premise of equity, we're giving everyone a stool that is proportional to their height. So now hopefully we can all look above the fence. But I want us to take this one step further. To not just fight for equality and to not just fight for equity, but to fight for liberation and to fight for complete removal of the fence altogether so that all those who wish to play the game are able to. It's time to bring those from the margins to the center, and I believe in you, my graduating class of fall 2019. Thank you and congratulations.
Shanvi, thanks for those inspiring words. Your challenge to us around equity and liberation we take seriously, and we'll work to apply that in our work. We're grateful to have, I'm grateful to have had you as a graduate assistant and a student, and I look forward to what's ahead for you. Now, I believe you're all here because you came to get a degree, so let's move on. MPH degrees are conferred by the dean, and at this time I'm going to ask all of our students to rise, all of our graduates. By the virtue of the authority delegated to me by the President of Georgia State University and the authority vested in the President by the Board of Regents of the University System of Georgia, I hereby confer upon you and each of you the degree described in the official records of these commencement proceedings with all the rights, privileges, and responsibilities thereunto appertaining. So I guess we can congratulate the graduates at this point. Let me invite Denise Gavea back to the podium, and at this time we're going to recognize the graduates individually.
Thank you, Dr. Lynn. And now it's time to individually recognize this year's graduates. Is everybody ready? Okay, graduates, if you will now line up towards Gina and proceed to the stage as directed by our volunteers. Hold on. Bayan Al-Mohammed, Suzanne Bach, Annalie Crawford, Sharice Daphne, John V. Davashi, Michaela Edon, Pooja Gala, Emily Hosterman, Justin Johnson, Smriti Kare, Gregory Little, Sarah Hawa Muhammad, Eric Morrissey, Andromeda Mergen, Priya Nair, Kirsten Nicholson, Jennifer Aubert, Emo Ocon, Leslie Onyenwenye, Sanjana Saini, Chinadu Agunu, Ashley Stain, Tierra Starr, Courtney Stroh-Snyder, Natalie Tripp, Kadisha Wilford, Shayla Williamson. Mackenzie Zent. Let's have a round of applause for all of our graduates.
Please be seated. Graduates, congratulations on your achievement. This is truly a day of recognition and celebration. You joined more than 1,100 School of Public Health alumni and over 200,000 Georgia State University alumni. One of the things that we have to remember is that when we accomplish these degrees, that in most cases, we haven't achieved these through our sole efforts. There are almost always individuals who have supported us and guided us along the way. So let's take a moment to recognize some of those individuals. The faculty and staff in the School of Public Health have really made a commitment to your success. They've shared their knowledge and expertise, advised you, and even pushed you to accomplish more than you thought was possible. So let me ask the faculty and staff to please rise and for you to please join me in recognizing the faculty and staff. Graduates, can you do better than that? There are also some other people who have been vital to your success, and they're the individuals who are sitting behind you. Those who instilled in you ambition, tenacity, a desire to learn, and a commitment to serving others. Those who encouraged and supported you regardless of the circumstances, even when the road got a little rocky. So graduates, please join me in thanking all those here today who are sharing in your accomplishments and without whom you wouldn't be here. So let me ask the parents and grandparents of the graduates to stand and be acknowledged. Additionally, will the spouses and partners please rise and be acknowledged? And finally, if we have any children and friends and anyone else who assisted these graduates along the way, please stand and be recognized. Please join me in recognizing and applauding our graduates one more time. Graduates, once again, congratulations. Please stay in touch, keep us informed of your progress, and return and visit us often. We wish you the best in your future endeavors, and we look forward to all that's ahead of you. Congratulations. Thank you.